So back to the question, it's good that everyone's talking about this, and hopefully if your wife is with an OB practice, that if this is a conversation on the table right now, that's a helpful thing because they're doing their best to avoid it. So again, what's to avoid? What's the big deal? One of the things I like to point out to people who are considering C-section, certainly electively, is that it is major abdominal surgery. Okay, let's make no bones about it. And if you are interested in getting a C-section or you take a childbirth education course, you should really see what one looks like. It's a major operation. It's very different than a natural physiological birth. And I worry sometimes how, women sometimes feel that they're afraid of labor. A lot of women have never seen a natural birth, and their image of what natural birth is like. And when I say natural birth, I don't even mean like, all natural, no drugs, in a jacuzzi or a birthing pool or that kind of thing. I just mean natural as in vaginal, physiological, normal birth. That it's not like you see on TV. If like ER is your frame of reference for how birth goes, you're going to have a very one-sided and very really an incorrect version of how that goes. So anyway, but back to the notion of a C-section being major abdominal surgery, you have to consider that. And there's a major recovery involved. We're talking about 6 to 8 weeks for recovery at a minimum. And during those 6 to 8 weeks, you're not allowed to lift anything. I mean, I'm sure women still do it. That's the whole thing. You're recovering from surgery and you have a newborn baby. So think about that for a second. Having a newborn baby is a huge deal, not only in the emotional sense, but in the physical sense. It's very demanding. You're tired. The baby needs you all the time. You're nursing, hopefully. You're tending to a newborn's needs, and you have a big learning curve. You went from one day just, being an ordinary pregnant woman to suddenly having a baby that you are responsible for. And it's daunting. So imagine all of those things, getting used to all these new things with the baby and being in a lot of pain from surgery that you just had. It's not a great combination. If you've had a C-section, you will need a lot of care afterwards from not just your partner, but from everybody. He can't do it all. You kind of need around-the-clock help. So I think that alone is a great reason to want to avoid being sectioned in order to give birth. There are a couple of other reasons, though. I mean, just the risks involved. Going back to the statistics about fetal and maternal mortality, it actually is safer to give birth vaginally. I would hope people know that, but I'm just kind of putting that out there as looking at the statistics. It is safer. You have less room for complications. Surgery does have complications, right? You could have complications being just cut open. You could have a reaction to the anesthesia. You could be sewn up incorrectly. You could, sometimes they with a scalpel, they nick another organ inside of you. You could have bleeding. You could have, I don't want to scare you or anything, but there are definitely things that can go wrong in surgery that don't typically go wrong in a normal birth. All of those things don't happen. I mean, you might tear on the perineum or something, and that would be stitched up. But, generally speaking, there's not a lot of suturing and so forth going on when you have a vaginal birth. And then the third reason that I want to cite for why your wife might be leaning towards a normal birth instead of a C-section and an operation is the experience itself. And, I really don't want to undermine that at all because that's a very significant part of birth for a lot of women. Not for all women, but for many women, they view their birth as an opportunity to experience something that's transformative. I mean, let's face it. So for a lot of women, they want to have that experience in the way that they imagine it to be, and are looking for a profound experience that they know is not going to be the same if it's an operation. The other thing I want to say about C-section, of course, is if you plan on having more children. When you, the rule used to be once a C-section, always a C-section, and then we kind of got away from that, and women were trying to give birth vaginally after having had a C-section, and that's called a VBAC. And then VBACs got a lot of bad press several years ago. They were associated with uterine rupture and a few other very serious and potentially fatal side effects. I don't know if that's the right, or risks, I guess, would be the right word for it. And so a lot of practices stopped offering a VBAC. Now, I'm not going to discuss the particulars about having a vaginal birth after a C-section, but it's important to know that because we're not in a climate right now where it's favorable to do so, if you want to have more children, having one C-section becomes problematic, because you're going to have, if you're having more children, you're going to have more C-sections, basically. This is, more serious in communities where they're bearing lots of children, like the Orthodox or Hasidic community. If they have a C-section, first off, they're in big trouble. You can't keep having C-sections. You just can't keep doing them. The uterus can only take so much. You can't keep slicing into it over and over and over and over again, which is what happens frequently. So that's something to consider too. So just to wrap up your question, reasons why you want to avoid C-section: recovery is difficult, harder for the woman to get used to having a newborn while she's recovering from major abdominal surgery. 2, as an adjunct to that, the sort of risks that are associated with major abdominal surgery, right? 2, the transformative experience, missing out on that, right? If you have a C-section. And 3, subsequent births, avoiding it to begin with in case you have more children. Okay? All right, let's go on to the next question. Okay, next question. Can you get pregnant while nursing? And what are some of my birth control options? Okay, I actually answered this question before, but it was several years ago, so I'm going to go back to this question because it comes up a lot for women. The question, can you get pregnant while nursing? And the answer is yes and no. I really have to clarify how you define while nursing. So if you're nursing around the clock, right? If you have a young baby who's not getting any other supplemental nourishment, whether that's formula or you've started them on solid foods. So if you're nursing full time and you're nursing through the night, then chances are very highly likely that your hormone level is such that ovulation is suppressed. If you're not ovulating, you're not getting your period, and you are not fertile, you're not going to get pregnant. Now, once you get past the sort of 6-month point, if you continue to nurse a lot, chances are you might not get your period, and you may or may not ovulate. So I feel personally like it becomes a little bit of a risk. It becomes a little bit of a risk at that point. So if you really want to do it, if you're really determined not to use birth control, sort of artificial birth control, and use your nursing as your means of birth control, then you really need to look into it. You need to do your research and understand exactly what the parameters are of how much you should be nursing in order that ovulation is suppressed. The second part of the question is, what are some of my birth control options? Well, the question didn't include the issue of nursing, but because I'm a breastfeeding advocate, I'm going to assume that you would be nursing. I'm just going to assume that. So, assuming that that's the norm, because, slowly but surely that is becoming the norm. there's probably not there are not that many other circumstances for which birth control would become an issue if you weren't nursing. So what I mean to say is that if you are nursing, your birth control options are